Hello, and thanks for joining Community InRoads Watch for the Helper series during COVID. My name is Joan Kulash, and today I feel particularly grateful to have two very special guests joining me today, Maria Gonzalez-Muller and Kathy Flynn Redard. Welcome to the two of you. Many parents who have been on lockdown during the pandemic and have children at home crawling all over them while they're trying to work are going to relate to how important Maria and Kathy are to the community and why we are calling them particularly angels during COVID. Maria, can I start with you just to have you, and just very briefly with a few sentences, introduce yourself and just a few sentences about your emergency child care program, and then we'll get into greater detail later.
So my name is Maria Gonzalez-Muller. I am the CEO at the community group in Lawrence, Massachusetts. We are a large nonprofit early education and care agency, and one of the agencies in the state that decided to open an emergency child care program for essential workers, medical staff, and families in crisis. Those are our three priority families. We opened at the late March through mid or beginning of June, when we were told that that service was stopping, and then early childhood education field was reopening.
And so, Kathy, you've been the CEO of the community group for, like, is you going on your second year? Is it your second year? I'm sorry, not Kathy. I meant to say Maria. Excuse me.
Oh, I'm sorry.
Thanks for that, Kath. It's like Kathy's going, I'm the CEO of the community group? I don't think so. Maria is. How long have you been in this role?
So in this specific role, it's been a little over a year.
Yeah.
I have been with the agency for 25 years, but yeah. I just...
but boy, what an initiation that was.
Yes. Certainly not what I was thought what I thought it would be. Not what I signed up for, but it definitely was a very good year to learn a lot too, and get closer.
None of us got training for that, right?
No.
So Kathy Flynn Redard.
Hi, how are you? Thank you, Joan, for having me. My name is Kathy Flynn Redard, and I am the Executive Director of Child Care Services at the Merrimack Valley YMCA. And I also oversee our food insecurity programs. And I've been with the Merrimack Valley Y for 5 years. During the initial shutdown of the state, we opted not to offer emergency childcare and instead pivoted our focus to easing food insecurity within the community. So that was where our focus was. And then we reopened childcare July 6th when it was reopened in phase 3.
Mm-hmm. So here's the deal, and I already mentioned this. It's we've all been prepped in some way, shape, or form to become the executive director, CEO of a nonprofit, and then comes to this thing that most of us have not experienced in our lives. I know I haven't, and I've been around a little bit longer than you have on this earth. And there are these curveballs. And the big word in the nonprofit community is pivot. How do we pivot? And so there are challenges that are confronted by our nonprofits and challenges by the people who we're serving, right? So I'm wondering if the two of you could talk just a little bit about, what the challenges were for the parents and also for your organization.
Yeah, I can start.
Sure.
I mean, I think the initial challenge as an organization or on a personal level, it was the same as everybody, right? There was this disconnect and uncertainty. We didn't know, because it was unprecedented. And we felt a disconnect from our families. We're all about children. We wanted to get that connection and figure out how to connect to our children. So we assess our communication methods. How can we communicate with families? What are the communication barriers? We wanted children to continue seeing their teachers and friends and some sort of an early education, but we also knew that our families have some urgent needs. that were unrelated to childcare. And we also noticed one of the big realization is that families, the level of trust that exists towards early childhood educators is huge. I mean, we take care of their children. What else? What is better? You know, what's higher level of trust than that? So they were looking at us for guidance in terms of where to go for the urgent needs they had at that moment. So we pivoted into finding resources for them. And one of the things, and going back to Kathy and the wise decision of not offering childcare, emergency childcare, has to do a lot with the way Lawrence specifically works too, because we're both located there, have centers there, and where there was one emergency childcare center, but then there was a need for food as well. So they were satisfying that need. So there was a lot of collaboration between nonprofit agencies so that we can all provide needed services without replicating efforts. And that worked very well. The emergency childcare specifically, and I can go a little bit more into detail, it provided much needed services for the essential workers. Immediately, we started getting personnel from the hospitals calling us. But we didn't know how to do that under pandemic. So that was a huge challenge. It was a pilot, and it required a lot of some convincing or just guidance for teachers in terms of, we're going to do this in the safest way possible. You know, we didn't have a lot of information in our hands. So that was a big challenge right then and there. However, it was a great pilot, and we were able to try new practices that could become the new norm going forward. And that, you know, we started from like, everybody gets their own pen, because, you know, if a family uses a pen to sign a document, then the next family cannot use the same pen. So little details like that we had to pay attention to, and we slowly adjusted the systems to make it more efficient and faster, and to the point where I think the same systems that programs are using now in reopening. So we feel a lot of confidence now, and actually I think a lot of our successful practices provided data that proves that it can be done as childcare is reopening. I think we're being very successful and have proven that we can avoid or, you know, we can implement health and safety standards while keeping everybody safe and providing early education services.
Maria, when you said that you had hospitals calling you, in what regard? So they
needed staff. They needed personnel to work. You know, everybody was afraid to get out of their house. You know, but they still needed nurses, doctors, just medical personnel, you know, administrative staff to function. So they were actually, all the emergency programs were listed on the state, and we were the only program for a while actually in Lawrence. So we were getting a lot of phone calls from corporations and medical and essential workers just asking us for services. I mean, we had a limit too, that there was a limit of 10 children per classroom. So, and up to 40 children in the center. You could not have more than 40 children. So people wanted to make sure that they had a spot, and they were able to work, continue working.
Got it. And Kathy, how did the YMCA and the community group kind of work together and communicate so that you knew who needed what, and what was the process? Was it just that by osmosis people knew? Or?
Well, it just kind of, I mean, we work closely together, you know, in non-COVID times. And I think the shock of childcare being shut down for such a long period of time. I mean, generally we don't close. We're open on snow days to meet the needs of working families. So, you know, when the governor shut down childcare, it was a bit of a shock for, I think, everybody. And then, you know, Maria and I talked early on, and just, you know, looking at what services we can provide, where our needs are. You know, food insecurity was very apparent for us at the Y. We have 73 gentlemen that live in the Y building themselves that need services when everything shuts down. So that, you know, helped us make our pivot. And that, and our children, if they're not in school, a lot of them don't have meals. So knowing that community group was doing the emergency care, you know, helped us make another need for, you know, both our families and their families in the community of Lawrence and surrounding communities, because we had families coming from all over for the grab and go meals that we were able to provide.
And did you also refer people to the community groups
Yeah,
emergency?
so if families called and like, we are looking for childcare. I'm like, I'm sorry, we're not offering emergency childcare, but the community group is, and this is their number, and explain the whole process that it is limited. It's limited capacity. It's on an as needed basis. Like, you don't enroll into emergency care. It was kind of, if you needed it, you went. But so we referred them back over to Maria's programs.
Okay, got it. And as far as the food piece, then Maria, did you refer them to the YMCA and the other food pantries? And
Correct. I mean, we knew where all the resources were. All the nonprofit organizations met every Monday to continue assessing the situation and see where the needs, kind of refining where the services were being offered to make sure that they were accessible for all families.
Mm-hmm. So the other problem that the nonprofits were going through, so you've got increasing demand, right, Maria? And Kathy's sending families over to you. So it's limited to the number of people you can have that you can bring in. And on top of it, I'm just wondering about your staff. Like, did all the staff say they all agreed that they would come in and work with the kids? Were there any staff that said, this is not a good idea?
So we made it optional. I was not sure what to expect, to be honest. But this is where early childhood education workers are amazing. I sent a letter to over 200 teachers that we have in our system, and I described the situation to them and made it completely optional. We did pay a higher fee, obviously, because of obvious reasons. And I received over 30 responses, and we were looking for about 6 or 7 teachers. So we were able to be staffed throughout the entire time with no issues. And that was a beautiful surprise, though, of how committed the early educators were to continuing the care of children. Specifically, our program has a very high number of children under the custody of the Department of Children and Families. So we work closely with DCF to make sure that the families that were in crisis, because again, they were home and some of the families were in severe crisis, had options and they could send their children to our center as well. So we ended up with about 1/3 of the enrollment was children under the custody of the Department of Children and Families, and they were able to get out of their house and continue socializing and having a healthy meal and just getting what they needed during the time.
Yeah. So what did you do did you have a lot of people you had to turn away then? How did that work?
No, it really wasn't. We were never at 40, 40 was our limit, but people was actually staff, essential workers in general were encouraged to find alternate care because not much was known, and we weren't sure that group childcare was effective at higher numbers. So families were encouraged to find alternate arrangements if they could do it through a family member or individual one-on-one, care. So a lot of the families were able to find that. We were afraid that we were going to have to turn people away, but we never did. We had anywhere between 25, 30 kids daily coming in, served probably about 40 to 45 families in total. And they were mostly medical workers and from the city.
Yeah. And so Kathy, you're opening up now, or you're planning to, or you already are?
No, we reopened on July 6th.
On July 6th.
Yeah.
So that must have taken some of the burden off of you, Maria, or how did that work? Yeah.
The last day that emergency childcare was allowed to operate was the 10th of July. So we closed our program and then reopened our regular programming soon after that. Some of the children that were in an emergency care actually were transferred to our program permanently after that, which was a positive thing. And the families were able to continue consistent care for their children.
Yeah. So Kathy, you open on July 6th, and what did you have to do? I mean, there's all kinds of requirements that the governor puts forward in terms of being ready to open up, I would imagine, in
Yes.
particular childcare. So what
There
do you have to go through?
There was, the state released, the Department of Early Education and Care released their guidelines, their health and safety guidelines, which were the bare minimum of what we needed to meet. And we changed policies. I mean, we have to limit the amount of adults that are in the childcare space. So we now offer, we now do curbside drop off and pickup at all of our locations, Lawrence, Methuen, Andover North, Andover YMCAs. And we do a health screening before the children get out of the car. They're asking them the questions that are recommended by the CDC. Do they are they feeling ill? If they've been near anybody that's tested positive for COVID, have they traveled anywhere? Lots of sanitizing. Child care has always had strict sanitizing rules, but this was not a big shift for us. Same with hand washing, but just educating the staff on what to watch for, limiting our group size. We're at a group size of no more than 10 children in preschool or school age programs, maintaining social distancing, children wearing masks, changing, no field trips this summer. That was always a big thing for our school age kids, was to, go on a field trip each week and go to the boathouse at the, Greater Lawrence Community Boating Program. So there was a lot of changes. As Maria said, emergency care definitely ironed out the kinks and made it, paved the way for us to make it much easier. I think the anticipation for the staff of what it was going to be like and for the parents was far harder than the reality. The children were so excited to be back. The staff were excited to be back. Families were, glad to have a routine and some sense of normalcy in their days. It's gone beautifully.
Yeah.
And we've learned to adapt. Like, we don't have a large sand table, but everybody has their individual little sand tables that they use. Everyone has their individual Play-Doh that's made daily. So, their own crayons. So it's all it's achievable, it's doable. And it's just great to have the kids back in our program and to provide that continuity of care for them.
So you said you make each child his or her own Play-Doh every day?
And they get it in a little bag with their name on it, and everyone has their own bucket of their materials each day, because we can't share materials. It's not safe. And you can't,
Right.
Taking away sensory activities is, that is a critical part of early education. So making sure that is available to them is, making daily Play-Doh and individualizing it is what we do.
So the kids leave, and then your day begins by cleaning up and making Play-Doh. And what else do you have to do in prep for the next day?
Well, they clean throughout the day. It's a nonstop thing. When the children go outside, then there is a sanitizing that goes in. There's a whole schedule of their, sanitizing. We have increased our cleaning services with our outside vendor. They come in midday as well. So it's a lot of prep, a lot of planning. But it's part of what early ed has always done in the school age program. It's their jobs have not. They've always their jobs have always been in other things as needed, and they truly do it. It's just there's not you do this and that's it. It's
right.
Cleaning throughout the day has always been a priority.
I'm looking at Maria's face while you're talking with this smile of yes, in agreement. This is what you go through as well.
I mean, we have very similar practices. We take this very seriously. And again, there's very specific rules that we have to follow. And we spend a lot of time, I'm sure Kathy as well, outside. I mean, fresh air is one of the most recommended practices. So we spend as much time as possible. This is a great time of year to be outside, which is great. And we go for a lot of walks, 6 feet apart, but everybody with their individual materials. We're trying to be very creative in terms of kids getting very excited. And teachers are stepping up and coming up with activities that adjust to the new regulations and protocols. I think attendance is not 100% yet, because there's a lot of parents that are a little bit cautious and concerned, rightfully so.
Yeah.
But I think what we're doing, we're trying to take as many pictures as possible, as many videos, and show that the children are having a high quality time and they are happy to be back. They are actually wearing their masks. And this
I
is
was
a
gonna
very,
ask you guys that. So the kids are wearing the masks.
I find in our centers, and I think Kathy would agree that I would say the large majority, always as little as 2 years old are already, are wearing their mask all day long. And if not all day long, they do have mask breaks, obviously, but they're always going to be 6 feet apart when they have mask breaks, and they are used to washing their hands every 20 minutes for 20 seconds, and it's becoming a routine for them. And you know what, this is something they have to learn anyways. So we're making it fun while they're learning it, because we as adults had to learn it too. So we're just, we're teaching them something that really they're going to have to remember even when they're not in our centers. So I am expecting that as the level of confidence increases, we have more parents coming in. I think the parents that are in right now are the parents that are actually essential workers that really need to be at work, and that they may not have other options, but they're also are more comfortable with the practices that we have in the programs and are more trusting of them. And slowly that will continue increasing, because I have to say, in the emergency childcare, we did have exposure. I mean, and there's no secret on that. We had a positive case with a teacher, or we had an exposure on a family, or a parent had a positive case as well. And as soon as we identify it, we remove the required person. We never had to close. Well, no, I shouldn't say that. We had to close the classroom at one point because of exposure, but then there was no further diagnosis, and everybody came back. And after that, any exposure that was reported had no consequence. We just did whatever we had to do, and then quarantined that one person or that one child. And then once they came back, everything kept going as normal. So I think the level of comfort is actually increasing, and we're still going to be very careful, of course, but it's working, and we're following recommendations from the epidemiologist that is working with the Department of Early Education and Care, and from all the CDC documentation.
Kathy, are you finding the same as Maria is, as far as the kids, abiding by the guidelines and wearing their masks and staying 6 feet apart?
They are, and they're really good. They're good about not hugging each other. That was probably hard for them to make sure that when they came back, they're so excited to see their friends, but like they do the elbow bumps and they do the air high fives, and they really are aware of the rules, and it's for their safety, and they do wear their masks, especially when they can't social distance. Hand washing, they're singing happy birthday twice. It's become second nature for them,
Yeah.
which is wonderful. There was all this, worry like, oh, will the kids be able to do it? Will it be too hard? And kids are just so adaptable, and they're amazing, and they just have gone with the flow.
If it's not 6 feet apart, they are going to be wearing their mask. They do know that. So I have to say, I know it's unrealistic to expect a child 6 feet apart at all times, but if they're a little closer, they know. I mean, it's almost like becoming second nature. Put that mask up, make sure that you're covered.
See, I find this amazing, because one of the things that I thought that you were going to say, and maybe that there is a little of this, is some emotional trauma from all this, and fear, because it's a very scary thing. The whole issue of maybe losing family members who get sick or have gotten sick, and knowing that there's something dangerous out there, and that's why you can't go to school, and that's why you can't touch somebody, and you're finding pretty much tremendous resiliency.
I mean, I think we are. I would agree, right, Kathy? And I think professional development too was a part of this for teachers. We want to make sure that we have nurturing interactions, that the children feel relaxed at the program. The children have some trauma and some anxiety themselves that we needed to make sure that we communicated with them in advance, and had a full week of professional development and training and preparation, because this is all new rules that they were coming to as well. So right. I think it starts with the teachers, but then they pass it on to the children.
Yeah.
And recognizing that this is a stressful time for the staff. Like, we had staff come back before the kids re-entered the program to get used to being out of their homes and with people other than, you know, their family members, and to do the professional development and the training on trauma, and just having a different, you know, all the different lenses that they need to have now in this time of our lives.
And everything's so up and down. We don't know what's gonna happen next, if we're gonna be needing emergency care again, and we're gonna be needing your help with the food. Are you doing any of that? So you still have a pantry though with the
Yeah,
work.
we still have pantries. We're still
Yeah.
serving at the Lawrence Branch grab and go meals every, you know, Monday through Friday from 3 to 5. Fridays, we still give out 2 meals, you know, for Friday and Saturday. You know, our children that are in the Lawrence and Methuen locations get, you know, a lunch and a super snack in the afternoon and morning snack. So those, you know, needs are met again, you know, through the program. But the grab
Oh,
and go meals are available for the community.
yeah, and that's such a huge issue with the food lines growing and growing and growing,
Yeah.
and resources shrinking. So let me ask you this question. We're on TV right now, and there are people watching us. If there was anything or some things that you would like to ask a public that wants to help, there are people out there that want to help and want to make a difference, and they don't know what to do. So do you have any suggestions as to how they may be able to help your organization, help the kids? What do you say to them?
Well, the first thing I would say is to thank your early education teachers. You know, the teachers in our field are historically underappreciated and underpaid, and our communities could help us increase awareness about the value of their work. I would also ask for help in advocating for recognition and funding for the early education field. You know, the voices of parents and families are most powerful for for our legislators. You know, we wanted to be talking about their experience with early childhood education. Did their preschool teacher make a difference in their lives? You know, with regards to being allowed to work, or was the child ready for kindergarten? You know, we all know the benefits of early childhood education. And kindergarten readiness, especially for children that are that start with a disadvantage anyways, and children in general. And to help us with recruitment as well. You know, if you know somebody thinking about the early education field, you know, there's a lot of professional development opportunities available. You can refer them to the community group or your community program, so they can maybe get their feet wet and see what kind of a difference can they make and what kind of growth opportunities are there in our field. You know, we all started as preschool teachers at some point, and you know, we continued because we believe in the field.
Yeah.
And also just make sure that as we continue talking about sustaining the early education field, early education and care field, we think about it with an equity lens. We just want to make sure that all children have access to these services. You know, not all families, especially our families in Lawrence at the community group, and I'm sure for the Y as well, they don't have an option of hiring a one-on-one childcare provider. So these programs have to be available for all children to access.
Mm-hmm. Absolutely. And I think that conversation now more than ever is in the forefront of our consciousness now. So I think the more that we talk about that, the better.
Absolutely.
Kathy, what would you say?
I echo, you know, everything that Maria said, and I would just, you know, if people wanted to give back, it's a challenging time for nonprofits. So, you know, your donations are always greatly appreciated. You know, writing letters to your legislator, supporting the, you know, early education and out of school time initiatives, because, you know, public schools and schools are going to look very different in the fall, and, you know, supporting us on how the nonprofits can help bridge those gaps is important, and supporting that as well.
Are there any particular initiatives that you'd suggest that people call their governing officials to advocate for?
I would say for, you know, food insecurity, there definitely is, as far as extending the waivers for the meal programs through USDA is an initiative right now. Supporting the out of school time initiative is also, there's a bill on the docket right now for that as well.
Can you explain that a little bit more?
It's just supporting, the funding for those programs and the needs, the changing needs and the availability for us to meet the needs, the out of school time, when children are learning remotely, how to meet that gap.
Mm-hmm.
And that's a very
that's
quick
universal.
overview. Yeah.
Every parent has that issue right now, right? I'm sure, I would say almost every parent is thinking, who's going to take care of my child when they're home learning virtually? So we are those providers, and we want to make sure that the Department of Early Education and Care is aligning services with the Department of Elementary and Secondary Education, and vice versa, of course. But that's really important for the legislators to know. I don't know that there's a lot of awareness on this.
And so if anybody has any further questions about those initiatives and wanted some talking points when they called their legislators, can they call the two of you, Maria and Kathy, or would you suggest somebody else in your agency?
If they can call us and we can direct them to the, the proper channels. We can share sample letters to the legislators, with the, appropriate verbiage.
Perfect.
Yeah, we can work together on that for sure.
Absolutely.
And so is there anything before we leave that I'm not bringing up that you would like to bring up to folks before we think about signing off?
I think any questions, they can always call us. I think, if families are going through any type of challenges that involve early education and care, I mean, they should feel free to call us, in the field. I mean, we are huge advocates of the importance of early education and care, and we want just more support from the community and in recognizing that it's really important. Childcare is education, right? And education is childcare, as we are finding out. So we should be linked with the school department in terms of continuity of services, alignment of services, and it will serve us all well. I mean, right now, again, our children are having different schedules at the childcare level and at the school level. So we need to make sure that we meet somewhere in the middle.
And I should also make note of your extremely busy schedules. And I can't even thank the two of you enough for spending this time with us and with me. I really appreciate it. And I always learn something new when I talk to the two of you. It's very hard to get a hold of you because you are so busy. But when I do, I always think we need to do more of this. And so we're going to, and hopefully it's going to be soon at one of the local cafes like El Taller, or where else? What are some other good places in Lawrence that we can suggest for people to go? There were a couple more that just opened up, I think, or one that did, I thought.
No, I'm not sure which ones are open right now, so we'll have to do some.
I'm pretty sure El Taller is open outside. They have open outside seating, so we should think about that. In the meantime, I also want to thank the audience for tuning in, and thank North Andover Cable Access TV for having us on their show. If there are any people out there who would like to help Community InRoads by donating their particular professional expertise to do some volunteer work with nonprofits like the community group or the YMCA, please give me a call and we can talk about our skills-based volunteer program, which has been extremely helpful to help to sustain these very important organizations. So until then, we'll see you all soon. And see you on the road.